Good morning. It's still morning for a couple of minutes. I'm Don Trudeau. I'm the president of Benistar Administrative Services, Inc. We're in the group retiree healthcare services business. Not going to talk a lot about that now, but obviously it probably intersects with some of your interests, broadly. Our panel today is going to focus on some lifetime planning issues that we hope will be interesting for retirees and their families. And first, I'm just going to say a couple of things. Our panel is in the way of you having lunch, so we're going to keep that in mind and keep this moving along. The second thing is, even though we have a star-studded panel here, and we're going to get to that in just a second, with a lot of information, we're not going to talk a lot. We're going to try to engage with you. And so we have two attorneys on the panel, for example, who charge north of $500 an hour. So get whatever you can out of them for free now. And really, truly, we hope this will be a little bit more interactive and a little less us talking. I'm going to start with something to try to keep your attention. And I don't want to steal this from Harlan, but Harlan threw up like actual cash, but he never did anything with it. I'm going to do something with it. And here I have one judge. The judge is Eddie Stone, sitting here in the front. The best question gets $50, okay? We will be paying it. So I don't want to leave the panelists out. The best panelist answer gets $20, okay? So we're going to keep everyone engaged, I hope.
We will donate back to Retirees for Justice.
Well said, sir.
There you go. Today is a special day. I don't know if anyone knows it. If you do, please suggest what it might be. But today's date is a very important date. Anyone want to make a guess as to why it's an important date?
First day to start a new tax year.
He offered something was maybe about as important. It's the first day of the new tax year. That wasn't what I had in mind. It's actually today in American history. It's the start of the American Revolution, right? So last night was Paul Revere's ride, and today was the start of the American Revolution. So we're gathered here on an important date in U.S. history, and hopefully some of the things that we'll offer won't quite measure up to that, but will be equally important to you in your immediate lives. So I'm going to ask the first thing to start with, is anyone here not a retiree? Sponsors, put your hands down. Okay, so most of us here are retirees in the audience. And are any of you under age 65? So early retirees is how we'd say that. Okay. So in my field, and I promise you I'll get quickly to our panelists, in my field, retiree health care benefits are important, and they're especially important to early retirees. And in keeping with the theme throughout this about learning some different things, I don't know if has anyone here heard of something called the health coverage tax credit? Didn't think so. So there's an actual benefit that is available today and has been for more than 15 years that was sponsored originally by Senator Portman and Senator Jay Rockefeller that provided, it originally came into existence under something called the Trade Adjustment Act, and it provided an actual tax credit support for retirees between the ages of 55 and 65. Initially, it was if you were disrupted in your employment due to foreign trade or some other forces, but that tax credit started at more than 72% and has grown over time to 80%. The federal government will give you, and the easiest way to qualify is if you have any PBGC benefit being offered to you, but the federal government will provide you up to 80% funding for full benefits, for full health care benefits. And so the only point I'm making that I hope we carry through is that there's a wealth of information out there. There's a wealth of things to learn. I learned a lot from Harlan that I didn't know anything about. It was amazing. So hopefully throughout this day, you'll be able to say the same thing, and we're going to stay with that theme. So without further ado, I'd like to start with having the panel introduce themselves. We'll start right to my immediate right with Lori. And if you could just comment a little bit about, obviously introduce yourself, talk a little bit about what you do now, and then if you could answer one question for the audience, and that is, what do you see in terms of planning as the biggest challenge that they face? And then if you can answer it yourself, what's your role in addressing that?
Okay. Hi, everybody. Good morning. Good afternoon. I don't know if anybody's else remote on the West Coast, but good morning then. I'm Lori Epstein. I am an attorney, but I'm usually called, the Wizard of Oz, the good witch, the bad witch. I'm a good one, and so is my colleague Dave there. I had been responsible for all of estate and business planning at MetLife for well over 20 years. I also had responsibility for financial planning, and we were one of the first financial services companies to set up a special division to plan for a family who was a childhood dependent with special needs, and I know my colleague there is very involved as well. I transferred over to Mass Mutual doing the same thing, and then I went on my own, and I'm still doing the same thing. And what I do is I help people to understand that I'm called the rate of death lady. I always ask the question, what is the rate of death? And usually there's somebody in the audience that raises their hand and says, okay, I think I can beat her on this one. I know, it's 100%. Yes? The only thing is that how I say it differently, it's only, the rate of death, yes, is 100%. Only Walt Disney was frozen when he passed away, but the estate tax that he owed was still due. So they defrosted him and they buried him. So I am considered, my rate of death, yes, it's 100%, but how I like to say it, it's one per person. You only get one chance to do it, so you can't mess it up. And going back to your question, what is some of the challenges? The challenges is that everyone has a plan of what they want to do when something happens. It's not if. But the plan most of the time is up here. It's in your head. And that's not a good place for it to be when something happens. And people have said to me over the last, I've been doing this for nearly 30 years, there was an unexpected death. I said, no. It's not unexpected if the rate is 100%. It was just bad timing. And so hopefully we can inspire you to not be afraid and to take that challenge and to put the plan that's up here onto paper so that you're protecting those loved ones and your plans.
Mike Roberts.
Hi, everybody. Mike Roberts, CPT Wealth Strategies. And I just want to start by saying I've been doing insurance and planning and risk transfer for 35 years, or 3.5 decades. And I'm happy and proud to say that Don is a friend and a client, okay, and he's a good person. And that's how I know Eddie Stone, working initially with the GE retirees. And basically what we do is we help people, to Lori's point, to plan for the future. I actually have a couple of handouts there. They're still there, some left. And it's funny that you brought this up. I call it first steps, last steps. The first step is having a conversation. You got to talk about this, whether it's at the Christmas table, the Easter table, the Thanksgiving table. It could be at the July 4th barbecue, but you have to have a conversation. You really have to plan for stuff before it happens. Everybody gets religion at the car accident, at the emergency room. But you got to get religion before you need it. You got to get insurance before you need it. So basically, we do a lot of different planning with elders. I'm an accredited presenter. I teach long-term care planning to other advisors, and I educate people and hopefully get them to move. And really, what I like to tell people is it's more dignity protection as much as asset protection. My mom's 97 years old. I surprised her the other day when I came up. And she's great. I mean, she's got a hearing aid and she's got a walker, but, she's still doing her thing. She's talking to my kids, her grandkids, on FaceTime, and they're texting and they're playing games. And I'm one of the things that makes me proudest is that 30 years ago, I begged my mom to buy a long-term care policy from me. I really needed to make a sale. I needed the money, was what it was. But she bought it, and you know what? It's still paying for her care today. It's $10,000 a month at the Atria in the Bronx, right on the Henry Hudson Parkway. That's $120K a year that I'm not paying out of pocket or begging my deadbeat brother and sister to help me pay with. So that's what I do, and I'm also working with Eddie on a number of other programs to benefit retirees. One thing that we did is I got an association discount from Mutual of Omaha for long-term care, if you don't already own it, as a member of his association, you'll save 5% if you do want to buy long-term care. And I know that a thing that's super important to the group, Eddie told me, is that some of you lost your life insurance. So we've sourced 2 different carriers to get guaranteed issue life insurance for you. And again, we'll talk about that more at another time. But everything that we're doing, the focus is on asset protection and dignity protection. Thank you.
Thank you, Mike. David?
I'm David Dorfman. I'm a lawyer, and I kidnap people from nursing homes and hospitals. Twice this year already. 2 of them are still out, and they're not going back. Because that's what happens. People end up in facilities, and they don't want to be there. They want to go home. And one of the things that I do, I've got a van. I've got a van. I'll come and get you, and I'll bring you home. And Judge, sometimes what we do is we're very quick to start that court action. So when we're talking about that kidnapping issue, I've already got my index number, and I can say, tell it to the judge, she's staying home.
Wow.
That's a tough one to follow, but Eric, if you could.
Yeah, I was just
you could-
going to
if you
say, thanks for putting me after David, everybody. So, hey, I'm Eric St Pierre. I've been working professionally for 37 years, mostly doing consulting and a lot of stuff that would bore y'all, especially after listening to David's exciting story. But what I will say is I've been fortunate enough, my bio, for anyone who might have looked, says that I'm on the leadership team at Humana, which I was until about 6 months ago, but I thought so highly of Mr. Trudeau and Benistar, I'm now working alongside him, and really think highly of what we do. I echo the sentiments of the folks here. David's story is not something I've experienced, but both what Lori and Mike said, in my career, I've been really fortunate, particularly over the last 20 years, to work with a lot of retirees and group health insurance, and really have been out talking. I've spoken to tens of thousands of them, and the glaring theme that always really made my heart tug was exactly what they addressed, the what I call it planning ahead, the advanced directives, and they waxed much more poetically on it than I did. But it was really challenging to hear folks who didn't have that plan and ended up losing somebody and really weren't ready. They weren't ready for that dignity and asset protection. So for what it's worth, that was what I was really going to share was, it is definitely worth looking into that and doing that. And I can tell you a personal story. It happened to me with my grandmother when my grandmother was at end of life. She didn't have everything ironed out, didn't have it, put down, hadn't talked to her family about it. And I was kind of like her 5th son, because my father had me when he was a teenager, and a whole other more interesting story. But the reality is that we were really divided about what to do with her when she was ready to be at end of life, and she was verbally sharing that, but didn't have anything written down, and didn't have the plan, like Mike said, really memorialized, and more importantly, hadn't discussed it with everyone in the family. It was kind of like, oh, don't want to talk about that. So, not trying to get too heavy, but that's to me, it's one of the things I wanted to share. My realm of expertise, for what it's worth for this discussion, is I have had a long experience, as I mentioned, working with retiree healthcare insurance across the continuum. So glad to help out. And Don really shared some good information earlier about the pre-Medicare retirees and what's available to them. But there's a wealth of information and services available for folks that, our system is far from perfect, as everyone would probably have a story about, but there are a wealth of services and support out there. So for what it's worth, glad to have that discussion. And Don, I'll pass it back to you.
Thanks. And as I promised, I'm going to get you some value out of this free legal thing. So, but I want to make sure it's connected to what you all care about. So I'm going to prompt it with a couple of questions. Who in the room, just show of hands, and I'm not going to dig into the personal aspects of it, but who in the room has a dependent or a loved one that has special needs? Could be a spouse, could be a son or daughter, a grandchild, something like that. So there are a few of you, not as many as I would have suspected, but over time, obviously those things can develop. And I was hoping maybe Lori and David start with you, Lori, could comment a little bit about the particular planning needs for folks that have additional people to consider in their lives.
Okay, so, I've been working in this community, I know David is as well, for many, many, many years. When I first started at MetLife, before we started this division, autism was a part of an organization called NORD, the National Organization for Rare Diseases. And then, nobody really heard of it. And this is, remember, I started at MetLife in 1993, so this must have been maybe 1995, 97, whatever it might be. And then all of a sudden it starts being with diagnosis and different things. It was 1 out of 263, more prevalent in men, and different types of diagnosis. Just so you know, in January of 2023, the numbers came out, autism, on the autism spectrum, is 1 out of 37. So, and I've always said it, if you're not, usually if you're not, have a family member or something, you know somebody. The thing is, and I remember this from a long time ago, before I joined MetLife, I had my own law practice in New York, and I did a lot of elder care work, which was a new field. I was one of the founders of the New York State Bar Association on the elder law, which, it didn't exist before. And I remember somebody coming into me, a woman coming into me, and usually when somebody comes in to do estate planning, they usually cancel. They'd rather go to the gynecologist or the dentist rather than talk about a time when they're no longer going to be there. And so it was 3 times that she canceled. She finally comes in. I have my tissue box ready. And David, I'm sure you know the story. And she started crying as soon as she came into my office. She's 72 years old. And she said her husband had passed away. And her sister was diagnosed with Alzheimer's. Remember, this was now 1992, 93. And she said to me, I don't know if Alzheimer's is hereditary. I don't know if it's genetic. What if I get it? She lived in Tribeca area in New York, and she said to me while she's crying, she goes, "What happens to Robert if something happens to me?" And she said that she has 2 children, Robert and Stephen. Stephen lives out in New Jersey with 3 kids. She said Robert, and I'm not going to use the the R word. I don't use the, Robert was emotionally challenged. Robert was 45 years old, still living with her. And Robert would never be able to be independent. And she said to me, what happens to Robert if something happens to me? Robert cannot live on his own. And she said to me, this is the only apartment, and we never moved out of this apartment because this is the only place that Robert knows where to get the Cheerios. We never moved out of this apartment because Robert knows where to get the extra roll of toilet paper. And the thing is, we're into the 3rd and 4th generation where a child or dependent with special needs will outlive the caregiver. And the planning is different. Government benefits do not take a break, and you have to make sure that you qualify for them. And leaving an old aunt, leaving her estate to Robert because she feels badly will all of a sudden screw up the plans. And planning is different, and benefits are different, and you need to not forget about it. Just because you can't take a shower during the day because you're so busy and you can't leave your kids alone even though they're adults, doesn't mean you can't forget the planning. The planning is critical here because assets left to the individual or dependent with special needs could throw off their benefits, throw them out of a group home that they're living in right now, and change everything else. So you will probably know somebody, maybe a family member or a friend or somebody that has their life impacted by a child or dependent with special needs, and you can also start to be their advocate to say, get the plans done. It'll take the brick off the shoulder. A brick weighs the same amount, but the more it's on your shoulder, the heavier it weighs. And I know that's what we're talking about today with solutions for this. And I'll turn it over to my colleague, David.
David, before you answer, I'm going to get it more narrow for you. I'm going to prompt it with another question. So how many of us in the room have a will that's been updated in the last 10 years? Wow, really, really good. They're very participatory in this activity. So maybe, David, you could talk a little bit about threats that you see about not updating wills, not having the current, and here in New York, we were just talking earlier about the new Medicaid rules, et cetera. perhaps you could comment a little bit about the need to keep on top of those sort of things and how they might impact both financially and what you intend to have happen over a period of time in changing circumstances.
Sure. I'm a widower with 2 young autistic daughters. I'm a grandpa-age dad, and sometimes in the community we use the term forever children when we talk about things like not moving out of the house because they know where everything is and they're acclimated and accustomed. But I know my children are not really forever children at all. They're going to grow to be full-grown adult people. And the last time I was here at the Bear Mountain Inn, I wasn't wearing a suit, I was wearing a bicycle outfit, doing repeats up and down the mountain, training for the Ironman triathlon. And today, I could not do 4 repeats up and down that mountain. I'm a bit more deconditioned than I was at the heart of my training. But I also know that no matter how strong I stay, and even if I have a good diet, I need to know who comes next in my plan. And when we talk about updating things, my cousin Mark went to law school at about the same time I did. And we've been training partners most of our lives. And I knew that he was a great first choice to back me up, to be a trustee, to be an executor, to be an attorney in fact, to be a healthcare proxy. He knows me intimately well. But I also know as he ages and I age, his youngest son just started law school. We're very proud because we've got a family tradition in the law. My grandmother and her 2 sisters all went to Portia Law School back in the 1930s. So I've got uncles and aunts and cousins and now that next generation. So young Jonathan, who is only a 1L or first-year law student at this point, he is about to become a successor trustee or a nominated successor trustee because I know I might lose capacity at about the same time that my cousin Mark does. When we race, sometimes I would win and sometimes he would win. And when I think about our nursing home future, we're still in the same race. But I'll need that next generation to step up. I know Jonathan isn't ready right now as a 1L, but I know it's coming up on time for that next trust amendment because he'll be next up in the next generation in that line of succession. Because I need to think, what happens 20 years after me? Yeah, we didn't get a lot of hands raised when we asked about disabled people.
What does happen?
My oldest granddaughter, she's very smart, she graduates from college. And my son said, I said, we gotta look at Juliana, she's the oldest, but she's the smartest. I said, she should be also considered an executive.
Yeah.
And that's what we've done.
Yes, yes. And sometimes we pick a small collection. In my family, it's my younger brother who was considered the smartest. He's the scientist with Noah working on the satellites. And I was never considered the smartest, but I'm good with the paperwork and I'm organized. But we knew handling family matters that we had to have my sister included too. Because if it was just my brother and I, we wouldn't agree. There would be something where we disagreed, and each of us has strong personalities. So if I thought things should be this way and he thought things should be that way, I know what's going to happen. So we need my sister as number 3, because she's the peacemaker. So she's the one who says, neither one of you is right. Here's what we're going to do in between. we're going to take a little bit of what you said and a little bit of what he said, and here's what we're going to do in the middle. So we need that when we're doing the planning. One person grows to have a feeling of entitlement. They're in charge. They own the checkbook. What they say goes. 3 people can't steal a dollar between them.
Thank you for that. We can,
I'd just like to
yeah.
make a suggestion. His younger brother is an attorney, so we used, not him, but an associate, so that we didn't get into that.
Let's get the mics out, folks.
Microphone.
Mics.
So that we didn't get into that discussion.
Can you just hold on 1 second?
Hold on one
I want you
second.
to hold the question, because they don't want to miss a word of this. Oh, lunch, hurry up, lunch. She's a plant, right? Right, Ed? She's a plant?
So-
Okay.
Yeah, okay. So we chose his youngest brother to help us through the process, but he chose his associate, a friend of his, to actually physically do everything. Because then we knew that 2 people knew it. That was our legal part. Our health part, we taught a relative who is a nurse so that she would help us with the healthcare proxy. But now we've got scattered information all over the place in a certain sense. So what we did is we pulled it all together. We scanned every single document, which is very simple to scan it. We put it on a jump drive, and we handed it out to a few different people. So if everybody died in a plane crash, somebody would have not only the paperwork, but also would have it on a jump drive. So I think it's very, very important that not, and I say this all the time to people, it's great for you to plan, but make sure somebody else knows what your plans are. And the way to do that is to make sure you have a couple of things to back up. They don't have to look at the jump drive, they just have to know where it is or where the paperwork is. That's all.
Really good point. So maybe we could continue with this and open it up, questions around planning issues, anything around the role of insurance in that planning process, anything around the role of healthcare planning, and that could include both the health benefits portion of it, what happens when you're disrupted from health benefits. Fortunately, I think most of us in the room are all Medicare eligible, and so that appears, there's not a political statement, but that appears fairly safe for some period of time. So anything in any of those areas for any of our panelists?
Can I ask a question, Don?
Yeah, go ahead.
Again, by show of hands, how many people in the room actually own long-term care insurance? Not a lot. So everyone else in the room has hundreds of thousands of dollars earmarked for their care, correct? $10,000 a month for 3 years on average? Because that's the numbers, okay? I didn't make this up. Genworth, big insurance company, they put out a study. It's always a year and a half behind usually. National average, so half of this is, median average. Half is higher, half is lower. Assisted living, we're all familiar with Sunrise and Adria and those types of places. Today, last year, 2021, the private one-bedroom cost, median average, $54,000. If we push it out to 2046, some of us will be here, some of us won't. We don't know. No one's got a crystal ball. That 54,000 is 182,000. Women on average live 3.5 years in assisted living care, men 2.5. Women are 82% of the caregivers. Women bear the burden, always. Forget the glass ceiling. It's who's going to take care of a loved one. And it could be a younger loved one. Paul?
Hold on.
1 sec.
Hold on 1 second.
Hold on.
I didn't hear it.
Mike, from your experience, are you familiar with these combination products, life?
Hybrid.
Hybrid.
Yeah, that's a good point, and something Don and I actually spoke about earlier. Before I answer that question, so that long-term care traditionally is to cover you from 2 years to 5 years or even lifetime. It depends how much your budget is and what your concerns are and what the longevity is like in your family. There are new products today, not approved in all states yet, called short-term care, much less expensive, that you can buy for 1 to 2 years and at least protect some of your assets. And again, I know I've said this before, it's not just asset protection, dignity protection. Again, told you about my mom. Love my mom. She loves me. I know her. I know I'm her favorite. She doesn't want me bathing her. God knows I don't want to diaper her. I mean, she doesn't need it. She's not incontinent. But these are the things that happen, right? she's very vain. She doesn't even want the nurse or the healthcare worker in her room when she showers. I'm like, Mom, she doesn't care. She sees naked people all day long. She goes,
But your mom cares.
My mom, so mom's like, she ain't seeing this naked person. So it's just a constant argument with her to have somebody in the room when she's showering. But the hybrid products that Paul asked about are products that are an insurance company manufactures, and they're either an annuity, a fixed annuity, or an indexed annuity with a long-term care rider that you get to spend down your money on a tax-favored basis for long-term care. Or they're a life insurance contract that you're pre-spending down the death benefit portion of the life insurance for your long-term care. And there are things called ADLs, activities of daily living. And again, I'll go back to this. They're listed in here, and you can Google it. You can grab one of those. But pretty much transferring, medicating, clothing, bathing, toileting, all those things. If you have 2 of those 6, they're called triggers. If you cannot do 2 of those things yourself safely, you qualify for long-term care. It's very simple to qualify today. So a hybrid product, a lot of people today are going away from a traditional long-term care product, which is long-term care only, and going into a hybrid product where they can tie some aspect of an investment to their long-term care or a permanent life insurance policy. Because in that case, you're killing 3 birds with 1 stone. You got permanent life insurance, which you're gonna need one day, to your point, 100% chance you're gonna die. You can spend down the death benefit, pre-death for long-term care, and if it's a whole life contract with a quality carrier like Mass Mutual, you're earning a 6% dividend, tax deferred, and you have life insurance and long-term care together. Does that answer your question?
If I can pick up where we were from there and why this is such a key thing to do. Nobody listens to you when you're in a hospital bed. Nobody listens. So what we've got is a child who is there and who is either going to ask questions of the social worker when we're talking about placement in a rehabilitation facility. They're going to ask questions like, on the one side, how much does it cost? How much does it cost? Because we want the best for our parents, but we also think, how much is this going to cost? And if you've got long-term care insurance, the child sits down in that meeting, waving the paperwork from the insurance company, saying, I want my parent in the best, most expensive, most wonderful facility there is, because it's already paid for. As opposed to how much is it going to cost. That's when they're saying, I've got the gold card. Make sure they get the best. And I think about this with my Aunt Elaine, because it goes back, but she was an early adopter of using assisted living. She was in what really might have been the first formal assisted living facility in Jerusalem, Israel. And when she chose that as a place she wanted to live, what she saw is that they were building a water park, a giant water slide, right next door, the next lot over. And she saw that water slide going up, and she said, I need help, that's where I want to live, because all of the grandkids are going to come visit all of the time to go to the water park. And it worked. It worked. I stayed with her when I ran Jerusalem Marathon, and all of the nieces and nephews came to visit Aunt Elaine, and not to watch me in the water park, not to watch me in the marathon, but to come to the water park.
To David's point, there are statistics that prove people who have private insurance always have much better care than when you're self-paying, because you're watching every nickel when it's your own money. When you bought an insurance contract, the insurance pays. So statistically, you're 100% right. The care is better. And I believe, I don't know who spoke of it earlier, maybe it was Eddie, people want to stay at home. And that's your choice also. These contracts today, you can stay at home and have community-based care, home care, assisted living. And again, assisted living, I tell people, it's a Holiday Inn Express that you never check out of, right? 3 meals on a cot. That's what it is. People confuse long-term care or nursing care. Nursing care or traditional long-term care is medically necessary care, but not given in a hospital. And that's really normally leads to end of life in hospice. And it just makes me think of one other thing. If anybody in this room doesn't know this, hospice care is free. Hospice is free, and if you want to know anything more about that, please reach out to me. You do not pay for hospice care for yourself or a loved one, whether it's in a home, a facility, a hospital. It's absolutely free, and people don't know that.
Don, real quick, just for what it's worth, man, I've loved listening to all three of these folks talk about this because it's a great example of how we really kick this off. Of making sure as best as possible you're covering all these bases as soon as possible because there's so many variables that come into play, right? Like I would have never thought of his aunt in Jerusalem thinking of that water slide, but it's a very legitimate point. Like it's consistent with anything else that we're all talking about today, whether you're leveraging reverse mortgage or you have health care benefits or you're talking about long-term care, or, whatever it is, it starts with the end in mind, as Harlan said, I believe it was Harlan, and talking about like what is your goal in the long run? What do you want to pull together? What's meaningful to you? And it's different for every person here, right? And that's I wanted to bring it back to what I heard from all three of these folks. It's key in planning ahead accordingly and making sure that you've got your bases covered with some people who can really help you make sure you're making the best decision for yourself and your loved ones.
So we have a little bit of time left, and it's a very close race on the best question. So if you have a question, now would be the time to offer something in terms of questions around planning horizon or specific elements. We've got a gentleman over here on the left. If someone can get him a microphone.
Run, Forrest, run.
Long-term care, does it have restrictions on, like, health?
That's a great question. Thanks. So in order to qualify for long-term care, the first question is male, female. Women are more expensive. Women live longer, have more moving parts, unfortunately, that break. So it's age, sex, has nothing to do with occupation or income, and your health. Okay, so again, long-term care is a prime example of get it before you need it.
Can I mention something before? I also want to interject here, for, that, and we spoke about this before. I do a lot, when I was at MetLife and still now I do lobbying just for, for people. And, I always look at what's on the burner, what's on the front burner, the back burner, and what's already legislated. So there is a New York proposal. It already passed the New York Senate, which is similar to the law that passed in Washington State. And right now, again, this New York proposal passed in the Senate. Now it has to go to then it will go to the Assembly, and then the governor will, and she said it'll be signed, which would be a tax on all W-2 income, with no cap, about 0.63, maybe 0.63%, to help pay for your own long-term care policy, because the state has seen how much of these things are costing the state. And so, again, will remain to be seen. We'll watch it, and I will like to propose. I'll send any information I get on the updates of that to it. That who knows what will happen. But it'll only pay for it, and going back to what Mike said, it'll only pay for basically 3 years worth at really something, very, $30-something thousand a year, which is nothing.
It's nothing. It's a de minimis rate. What happened in Washington was the state said, we can't afford to pay for Medicare for long-term care anymore. So the state of Washington basically just went ahead and passed this law, and they've since been forced to rescind it. It's on hold. But all the states are going to be doing this, and it's not a blue-red thing, but it's more blue prevalent right now, where the states are going to tax people to help fill up a bank account to pay for Medicare for themselves. Now, the way to avoid that is if you own a long-term care contract, you have to own long-term care, specific approved long-term care contract, policy code number, and all the things that we're talking about, they all qualify. Where if you own that contract before the law gets enacted and put in force, you are not subject to that tax, and you're off the hook for the rest of your life. However, if you don't own a long-term care contract before that date, whatever the line in the sand is, you're going to be paying that tax. And I just want to go back to your question about how you qualify. So there's really three types of long-term care. There's traditional long-term care, which I call auto insurance, right? And we all have auto insurance. Why? Because we have to, right? They won't let you drive without it. So long-term care auto insurance is you pay your premiums every year, and you pray and hope you never use it, just like your auto insurance, right? And that's traditionally underwritten to your question. The hybrid policies, to Paul's question, that are either tied to an annuity or a whole life contract are less restrictive and easier to get. Because if you think about it, the annuity, you're almost self-insuring with your money. They're giving it back to you on a tax-favored basis with some gains. And the whole life insurance, the insurance company is already selling you the mortality. They're selling you a life insurance policy. So they'll tack on the long-term care rider to get your money back tax-favored. It's easier to qualify if you have pre-existing conditions or health issues for the whole life or annuity contract than traditional. But each case is handled differently. There are certain things that are knockout questions. If you're already disabled, if you're already legally blind, things like that, you're not going to get long-term care.
Thank you for that. Any other questions? We have time for a couple more, I think.
I just want to ask about the long-term care that you said people between 55 and 65 can get the government to subsidize their retirement or their early retirement?
That was for health insurance,
Right,
for
health-
qualified health insurance,
okay.
not long-term care.
Oh, okay, health insurance. Now, what if you had, like the attorney here has two special needs children, and you're trying to get health care for yourself? Would that roll over to the other plan, or is it two separate identities? You have it for yourself, and if you want to get some kind of protection for your children.
Yeah, it's a good question, and it's fairly technical, the response. If they were, it depends on their age. So if they're under age 27, it makes it fairly easy. If they're not, but they're legal dependents and there's special circumstance for it, the answer is it wouldn't disqualify them, but it would go back to state insurance law and that sort of thing about who would be a qualified dependent on your insurance. Yeah. Yep.
Anything else?
Someone else right here in the middle of the room.
Right?
Hi, my name is Sue, and I actually just wanted to bring up a point. One of the pages in your information was talking about eating, bathing, dressing, and so forth. I just wanted to point out, because I went through with my sister who was in Pennsylvania, there are different levels of care in assisted living, nursing homes, skilled nursing, and even within like assisted living, there's different levels. I don't know how many, is it 1 through 12 or something like that? The place she was in, you had to be able to go to the bathroom yourself. They would not change diapers. They also, you were supposed to be able to eat yourself and so forth. I just want to point this out, that if people are looking into places, ask as many questions as you can think of and, get as much information, because would she have to be, like, if they're private pay and don't take Medicaid, that's another issue, because they would have thrown my sister out if she privately paid. And if she could not privately pay, they would have thrown her out. So, I mean, all these different things, I just wanted to point that out as something that's important.
Thank you.
And
Thank you.
And the other thing is, having gone through this with my mom, the first question they asked when we asked, first, and this is just me, I'm in the insurance business, but I ask a lot of questions. The first thing I asked them was how much was their current monthly rate and the different levels of care, to your point. There's 3 different levels that Adria offered. And I said, how many beds do you have? Like a hotel. He said, we have 323 beds. I said, okay, great. How many are full? He goes, 275. I said, I'm not paying full price. He goes, what do you mean? I said, why would I pay you full price? You got 100 empty rooms or 50 empty rooms. And he couldn't believe I was asking him this question. I was like, my mom has a benefit of X. If I pay the top price, it's only gonna last so long. If I get a better deal going in, it'll last longer. And I cut a deal. I'm saying you have to ask.
And it's also a great real life example of what these folks have been talking about, getting out ahead of it
Yep.
and game planning. And like I think David was the one that said, you want to be, God forbid, you or your relatives are sitting there at the table, you want to have that gold card in hand. Because make no mistake about it, you've both just described it. There are different levels of quality of care as well. So it's very important if this is of concern to you, which I think we all have expressed it really should be, that you're getting out ahead of it and you're prepared to
And
make
the
sure you're
first
taking care of
question
yourself.
they asked was, do you have private insurance? Now that I think about it. They
Absolutely.
wanted to know if we had insurance. If not, then they want to see you whole Dun and Bradstreet. How you gonna pay for this?
Yeah.
Last question over here.
Yeah, let me make a suggestion. Stay out of nursing.
Stay out.
And hospitals.
Wait, get the microphone because everybody needs to hear.
Stay out of nursing homes.
And hospitals.
I had my mother-in-law, she had Alzheimer's. I had my mother had polio when she was, I don't know, when I was born. So for 60 years she had polio. She was in a wheelchair. She ended up going into a nursing home, and she went in December or right after Thanksgiving, and the problem was you couldn't go into a nursing home unless you went from a hospital.
Oh, wow.
Okay? So I have a sister-in-law that's a head nurse. So I called Flo and I said, what do I do? Tell your mother she's having a heart attack. Try to tell an 82-year-old woman now she had heart problems. And I said, Mom, you're having a heart attack. I'm going to call 911. She says, I'm not having a heart attack. I said,
Yes, you are.
Mom, listen to me. Okay, I'm a volunteer fireman in the same town. 35 guys showed up at the door
that's
to
hilarious.
help me. Okay, and I'm still saying, Mom, you're having a heart attack. Well, it worked out great. But a month later, the state of Pennsylvania changed the law that they're going to now go after the properties. But before, they never bothered the property. So when she died 4 or 5 months later, okay, which I think was due to a lot of neglect in the nursing home. The state got most of the money, okay, because they were going back after what she had. My mother-in-law was in a nursing home. She had Alzheimer's. My father-in-law went in a nursing home, okay. My wife just passed away 2 years ago, and I didn't know it, but since 2009, she had mild dementia, okay. And I set up a trust that she's staying at home. I want in-house nurses. I mean, if you go to nursing homes and just smell the urine
Oh, please.
as you walk in the door,
Yeah.
I'm telling you, I'm telling you, I think you can. In fact, I had, like $1 million set aside for my wife if she needed it. As soon as she passed away, I closed the trust. But I know that she could have stayed at home in her home, and been basically been happy, and we could have a nurse come in. Even living at probably as much as it would have cost me to go to a nursing home. But I had a woman across the street, she died, she was like in her 80s, and they all kept saying you needed to downsize. She said, this is my home.
Right.
Why would I leave? I know everything, So, the trick is, seriously, nursing homes are a disaster.
Yeah, so I just want to bring up one other thing, and that's why I work with Harlan. That's why Harlan's here, okay? I believe in what Harlan does, and I believe in helping people free up the equity because especially at an advanced age, if you haven't aged out of owning long-term care, because there are age restrictions, taking equity out of your home is the only place you can get money to buy long-term care to protect your assets. It's really super important.
Well said.
Also, I think you can, because I looked at a long-term care, my mother-in-law was having a problem. Okay. What I did is I looked at a long-term care, and I did a lot of international travel.
So you are holding up the other people from eating.
Okay. Well, I just want to say.
We'll talk about this later.
Yeah.
We'll all be around at lunch, by the way.
Okay, sounds good.
And thank you for sharing. I want to thank all of you for participating. The last thing before I let you go, Eddie, who is the winner?
Okay, so the winners are pretty obvious.
Where's the microphone?
The winners are pretty obvious. I'm going to go with stay out of nursing homes,
tell your wife she's having a heart attack. And then, my name is David, and I kidnap people from nursing homes.
Yes, well deserved.
Thank you all again, and I believe that the lunch is set up right over here in the next room. We're all around if you want to chat further about any particular item or any private matter. Thank you so much.
Thank you all.